Dominica reports on its pilot program for climate resilience. 14 certified following phlebotomy training course, and police here increase vigilance along Dominica's routes. Thanks for joining us on another edition of National Focus. I'm Tasia Floissac.
And I'm Jarna Hector. Stay with us for details of these and other stories after the break.
You're watching GIS.
Thanks for staying with us. Dominica's strategic program on climate resilience was in the spotlight today when stakeholders, project staff and the World Bank met to monitor the program's progress. Dominica's $39.5 million project was approved for funding from the World Bank's Climate Investment Fund 3 years ago. Dominica's project was selected in addition to projects of 17 other countries to pilot their climate-proofing strategies. In September 2014, a coordinating unit was formed to lead the resulting disaster vulnerability reduction project. There are 13 projects identified to receive attention, including interior roads, storm drains, a seismic monitoring network, and a spatial data management system. On Wednesday, the objective was to report on the implementation status as well as to learn of other countries' progress. Lead environmental specialist with the World Bank, Cantor Rigo, presented on the challenges, lessons learned, as well as the progress of the countries selected for the Strategic Program for Climate Resilience, or SPCR. Importantly, she said, stakeholder involvement has been commonly identified as critical.
During the SPCR stage, and many of you were involved in, the requirement to document and the mandatory and document the stakeholder engagement exercises were really important, and we are finding that as we go through this program, that process has been very important because people were engaged. And one of the reasons that I think there is this process of the monitoring and reporting on an annual basis to engage all the stakeholders and through the SPCR is not for the program itself, is towards the national agenda, but that process of engagement has been very important in moving the agenda forward, and we hope that you continue to do that because it really does enhance positive relationships even at the level of the project.
She acknowledged that Dominica is doing well in that regard. The Honorable Minister for Health and Environment, Dr. Kenneth Daru, initially presented the strategy to the World Bank when it was conceptualized. He discussed the challenge of the program and a possible solution.
Much progress has been made since the launch of the SPCR. However, funding remains inadequate to meet all of the needs identified, since many of the costs estimated initially were indicative. A more detailed look at the costing revealed that the scope of the SPCR was greater than the initial available funding, and your government has been exploring ways to address the agenda by assessing the needs, including that of financing, which is why we are pleased to announce that our SPCR and our low-carbon climate resilient development strategy have been tabled at the United Nations Framework on Climate Change, and we're very optimistic that in Paris later this year, the Conference of Parties, which promises, of course, to be a breakthrough year in international climate change negotiations and funding, that our progress that we've made thus far on the SPCR and the low-carbon climate resilient development strategy can be rewarded by allowing us to leverage further funding.
At that event, staff of the Project Coordination Unit reported on Dominica's progress and the island's next steps were discussed. 10 additional countries have been approved to begin piloting the SPCR this year.
Tasia, let's talk about this strategic program for climate resilience. I remember back in 2013 being at that press conference when the Honorable Environment Minister announced to the nation that Dominica's project had received funding from the World Bank. And I remember him describing what that meant and listing a number of projects that will fall under that. And so many communities, so many smaller projects, and it just seemed like the entire country was going to be rebuilt.
Yes, well, actually, earlier this year, I myself sat down with him for an interview, and I understood that it's broken down into 4 major components.
Okay.
So that would be civil works, data management, emergency response, and general management, right?
Right. According to the project coordinator, the major work should begin close to 2016, and that's going to last for 6 years. And what that means, well, what that tells me is that climate change resilience is more than, well, it's not just weather related, it's actually development related.
Precisely. I think the fact that it's going to last for 6 years just speaks for itself, that it's going to be more than just about weather. In fact, from what I understood, a feature project as part of the SPCR is going to be the Hydromet network, and that is a system that is going to collect field data which will be transmitted via satellite for real-time report on water management.
Right. That also means that the Met Office will be able to give live real-time weather updates.
Yes.
So no longer will they be guessing and giving us long periods. We will be able to know, and that will also mean a lot for water management, rivers, reservoirs,
which is a large part of climate resilience.
Right, because for SIDS we have a lot of issues with flooding and basically water-related issues. So that could be a good thing.
Yeah, so we can safely say that we are making progress, and based on the event you went to this morning, GIS will bring you more updates as it becomes available.
Right. Moving on, 14 participants were recognized with certificates of completion following a phlebotomy training course. The participants were engaged in a 4-week training course designed to prepare them for employment at hospitals, blood banks, and private clinics. Phlebotomy is the process of making an incision in a vein with a needle. The procedure itself is known as a venipuncture, the collection of blood from a vein, usually for laboratory testing. Lab Superintendent Walter Jones highlighted the significance of this training course.
It's all about getting blood from the vein. Now, this, of course, is a very traumatic event for most people. Hence the reason why, for us, it is very important to ensure that the competencies that are required by people performing that procedures are according to standard. And so we ensured that we had a good blend of practical and theoretical lectures, and to ensure that people know exactly what they're doing. What we want is that the patient would have a good experience.
According to Jones, this is also important as it relates to a quality management system being implemented at the Princess Margaret Hospital. Participants were also trained in basic laboratory techniques like centrifugation, sample separation, and instrumentation. Nurse Deborah Roach says phlebotomy is more than just the drawing of blood, but is a procedure which should be executed with a great level of care. She cautioned the newly certified practitioners to be sensitive to their patients.
Patients measure your performance by how you express compassion and care. Patients and their families want much more from care providers than competent clinical care. That means the caring attitude is central to your performance over your clinical competence. And I usually say to the nurses, there is a specific area of the buttocks that we as nurses are trained to give injections. When you as a nurse are going to give an injection to a patient, the patient does not know about upper, outer quadrant. They don't know that. What they know, if the nurse taps my shoulder, she says to me, look, I will try to make it nice. And one of the things I use, I say to the patients, I put a little sugar in it. This is what the patients see. This is what to them is more important than the upper, outer quadrant that we know clinically is the right position.
Course participant Lester Guy was particularly pleased to share his course experience.
I work at the National HIV Unit, so dealing with blood on a daily basis is something that is just part of working, and most so I also come from the same background. But when you come to the nitty-gritty of it and you're doing a course like phlebotomy, it puts a new spin on things. It makes you see that it's not just taking blood. It's something wider. And one of the things that I find is really remarkable is that most of the young persons that were together in the course, they're already working. I've seen, well, there's a medical doctor who was involved with us. At least 3 of them are still at the lab. I've seen one working at a dentistry or in a dentist's office. So I know the course was very timely and relevant. So for the experience, basically, all of us had our experience, but it was just something that, on reflection, you say, whoa, if I'd done that before, would the experience have been the same thing? Obviously not. But with the number of persons that you have around you, people that you have around you, and the type of impact that they made on you is actually very good.
Certificates were distributed to the participants by Dr. Ruby Blah. You're watching National Focus. Still to come, the St. Joseph District partnered with the Dominica Diabetes Association to host a health and wellness fair. Stay with us.
Did you know the Caribbean Court of Justice is 2 courts in 1? The CCJ has 2 functions: an original jurisdiction, which deals with your right to move between CARICOM countries freely and your right to move your money and your business. This is the basis of the CARICOM Single Market and Economy, CSME, and the revised Treaty of Chaguaramas, and an appellate jurisdiction to hear appeals from courts of those countries which decide to use it as their final court of appeal and no longer go to the Privy Council. All CARICOM member states who have signed the agreement establishing the CCJ are members of the CCJ.
Welcome back. Police in Dominica have stepped up efforts to reduce the incidence of traffic accidents and allow a free flow of traffic, especially during rush hour. Mervyn Matthew has more in this report.
It can be a challenge trying to get to work or school for 8 a.m. and finding yourself in the middle of the early morning rush hour, bumper to bumper traffic for miles. Traffic as far north as Capuchin, far east as La Plaine, all pass through this point in Canefield for the final leg of their journey to Roseau. It is a challenging job for local police to ensure that overzealous motorists don't cause any accidents. With a recent spate of road accidents, some fatal, officers of the Traffic Department of the Commonwealth of Dominica Police Force have increased their vigilance, especially along routes like these. Already there are signs that the presence of this police officer is making a difference in the traffic flow in an area once popular with bottlenecks. Closer to town, under the Canefield Cliff, police officers are making a random check to ensure that licenses and insurance of motorists are intact and to ensure that seat belts are being worn. So the reports of reckless driving and overtaking along this roadway during the rush hour has reached the ears of local police, and they have acted in the best interest of motorists and pedestrians. It is hoped that random checks like these and police presence will reduce the incidence of traffic accidents along this roadway. For National Focus, I am Mervyn Matthew reporting.
Thank you, Mervyn, for that report. Last week, the St. Joseph Health District teamed up with the Dominica Diabetes Association in its hypertension program to do blood pressure checks for individuals in that constituency. More specifically, residents of Taru. With its program dubbed Blood Pressure Control Through Community Action, the Dominica Diabetes Association aims to strengthen civil society organizations to contribute to the prevention, detection, and control of hypertension at a community level. Addressing Friday's ceremony was Director of Primary Healthcare Services, Dr. Laura Esprit.
We have the main components of this community-based program as follows: the screening of patients for high blood pressure measurements, the ongoing monitoring for high blood pressure, be it both self-monitoring and with support, highlighting the importance of self-management and empowerment, and of course placing special emphasis on medication adherence and compliance. This critical initiative taken by both parties is really commendable as it provides benefits for the community members involved. Additionally, the Ministry of Health is in support of such initiatives, embarking on community action programs as part of its global efforts to the reduction of death and disability from non-communicable diseases among its population.
According to Dr. Esperi, it is noted that there has been an increase in coronary-related health issues occurring in individuals aged 50 and below. President of the Dominica Diabetes Association, Marvin Birmingham, indicated that this project is primarily geared at achieving one of the 9 voluntary global non-communicable disease targets set out by the World Health Organization. That target is a 25% reduction in raised blood pressure and a 30% reduction in salt or sodium intake by 2025. Family nurse practitioner Rebecca Uzeb was featured speaker at Friday's ceremony.
A healthy nation is a wealthy nation. Isn't that true? Now, we know that an unhealthy population drains a country's resources. We have the increasing number of diseases, particularly the non-communicable diseases. In particular, we have high blood pressure, diabetes, and the cancers, just to name a few. And these, we know, have serious consequences to individuals, to communities, and to the healthcare system. The system, or the healthcare system, is overburdened with cost for caring for its citizens. When we look at some of the consequences of uncontrolled high blood pressure and diabetes, we have stroke, amputation, kidney failure. This is a result of uncontrolled high blood pressure. I repeat it. Those conditions have far-reaching implications.
Following the ceremony, residents were invited to have their blood pressure checked as part of a health and wellness fair. The Dominica Diabetes Association is an initiative of the Healthy Caribbean Coalition formed in 2008 and focused on the reduction of non-communicable diseases in the region. And that's the English news. McPherson St. Luce is next with the Creole highlights.
Alors tout le monde, bienvenue à cette nouvelle en créole. Non, moi, c'est McPherson St. Luce. Premièrement, ministre de la Santé, Honorable Dr. Kenneth Darrow, attendait un meeting ministre de la Santé qui mettait attention pour taper assistance pour mettre en compte les gens qui ont souffert épicide et TB. Meeting ça là prend place en Saint-Lucie, check temps qui passe.
Nous attendons un meeting à Saint-Lucie. Pour ça nous kakoué pour nous voir comment nous ça continuer à taper l'argent pour traiter le monde avec sida. Quand nous savons que le traitement sida a commencé des 3 ans passés à base de la Clinton Initiative, après ça nous avons Global Fund take over. Mais l'argent ça a fini dans l'année prochaine. So l'année prochaine nous partons une pièce de monnaie pour nous voir l'argent qui sorti pour nous continuer à manager monde qui ni sida, HIV et TB.
Ministre Darrow dit qu'il l'argent avec là pour payer OICS.
So ça nous fait quand nous avons presque 5 millions US dollars, 5 millions US dollars qui est available pour ces pays OICS là. Mais quand tout bagaille nous recognize que si nous approach chaque monde pour quoi il était plus difficile. So ça nous fait nous approach les comme bloc OICS sub-region avec tous les ministres santé de OICS d'accord nous cal faire OICS commission dans West Coast pour manager projet ça là. En toute forme, le gouvernement a déjà dit que nous avons l'argent budget là pour continuer, pour gagner un traitement, ça c'est antiretrovirals. So là, l'argent ça a commencé à kicker en 2016. So nous pas qu'une pièce break in between pour manager mon qui ni HIV AIDS.
On a une nouvelle, premier cas plan figue qui le ministre de l'Agriculture recevait hot force, qui a tapé attention. Parole celle-là sorti votre officier quarantine, ministre agriculture, Ryan Ansem.
Gouvernement Dominique, ensemble avec BAM, Banana Company Measures, avec National Fair Trade. National Fair Trade, c'est une organisation qui a voué figue nous en l'Angleterre. Quand on tape une nouvelle, National Fair Trade pas qu'à faire ça encore. So ça, le ministre agriculture fait, nous travaillons avec eux, nous menons 20 000 plantelettes hors en France. Avec plantelettes, ça, j'ai en winning stage là, ça nous a fait, nous a mis dans Smart Greenhouse en Portsmouth, nous a fait très bien. Avec stage là, nous en présent, nous allons mettre dans potting bags pour faire plan même pour nous ces planter. Avec portuaire ou derrière nous là, c'est un plan qui a fait très bien. En 6 semaines encore, c'est planté à qui tapé ces plants ça là qui sans maladie.
Ansem fait parole qui ces plans ça là, c'est pour revitaliser l'industrie fake Dominique.
Ça nous dit des peuple Dominique. C'est plan ça là même, c'est un programme pour revitaliser banana secteur. Ça c'est un component, nous allons mettre ces plans ça là en Cassibus dans Calibichi, c'est là nous avons irrigation. So, c'est là tous ces plans qui allaient, nous pas qu'à dire d'autres planter où Dominique pas tapé, mais parce que place ça en irrigation, ça est là, c'est tissue culture plan qui allait. Et bien nous les dit Puebla aussi, c'est variety ça là, c'est ces variety à win freshly en les market là.
Et puis finalement, consultation qui mène stakeholders ensemble pour discuter production patate anglais, ça prend place en Dominique Jardin. Ministre agriculture en collaboration et puis gouvernement Canada facilite consultation là qui prend place en hôtel Garaway en Roseau. Plaisir officier fait présentation qui concerne cultivation patate anglais en parmi directeur agriculture Ricky Brumand.
Le ministère de l'Agriculture a regardé toute dawi qui a aidé l'économie dominique, qui a aidé planter dominique, qui a aidé habitants dominique. Nous avons regardé patate anglais, comme question dawi nous a travaillé avec, nous a fait planter faire la Jarna. Nous avons travaillé, nous avons fait détermination pour nous ni patate anglais comme un produit qui nous a mangé local et nous a exporté aussi. Nous, le gouvernement Canada qui a supporté nous un programme ça. Nous commençons avec ça comme que l'année qui passée. Nous avons fait un mouvement. Ça nous bon matin aussi c'est différents monde en industrie différents monde qui involve ça fait patate anglais ça qu'a fait aujourd'hui c'est nous avons joindre nous avons parlé côté industrie là nous avons vu comment nous ça fait plus mouvement comment nous ça développer patate anglais Dominique.
Monsieur Bruman fait parole que l'industrie patate anglais, c'est une bonne production.
Là, nous regardons ça fait figue Dominique, comment il tourne au temps Dominique vide. Et ça nous a dit, nous ça mettait figue en la main, monde qui ça fait, monde qui a une capacité pour planter figue, pour manager figue. Mais habiter que patate anglais, femmes ça fait, jeunes monde ça fait, et sont d'ailleurs qui a venu à dans temps coûte 12 semaines on y patate anglais, on y l'argent, ça ni l'argent poche. Bah là c'est industrie patate anglais, il y a un petit problème. Nous avons joué ensemble, nous voulons jouer ensemble pour nous résoudre ces problèmes ça, pour nous discuter et mettre ensemble en chemin pour développer meilleur. Industrie agriculture Dominique ça profiter, planter Dominique ça profiter, famille Dominique ça profiter, avec l'économie là même qui fait bien.
Messieurs, mesdames, ça c'est tout pour nouvelles en créole pour à présent. Non moins, c'est McPherson. Au revoir.
Coming up next, a tip to decrease clutter in your home.
Get in and fasten your seatbelt, okay?
Mom, why do I have to wear seatbelts? I do not want to.
James, when I ask you to fasten your seatbelt, please do as I say. It's for your own safety and protection, okay?
Yeah.
Protect yourself, protect the child. Always fasten your seatbelt. Crashes can happen at any time. It is better to be safe than sorry. Remember, seatbelts save lives. A message brought to you by the Violence and Injury Surveillance System Committee in collaboration with the Pan American Health Organization.
There are many little things we can do every day to play a small part in preserving the natural resources, reducing waste, promoting health, and even cleaning the air. One of these is parking in the shade. Clutter has been scientifically proven to raise stress levels. To decrease clutter, avoid zigzag organizing. Scattering your efforts over multiple rooms prevents you from seeing progress.
For a visible, dramatic result, work one room at a time, one section at a time, completing each area before you move on to the next.
And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm.
Like our Facebook page, facebook.com/GIS News Dominica, and follow our Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. From all of us here on the GIS News Desk, I'm Jarna Hector.
And I'm Tasia Floissac. Thanks for watching and join us again next time on National Focus.
Grand Bay Village Council presents Fête Isidore 2015, a celebration of culture and achievement. Come be part of Dominica's grandest village feast from May 21st to the 25th. Fête Isidore in South City, Grand Bay. It's the Feast of St. Isidore 2015 in Grand Bay. See you there.